have to start recording before I forget. All right. Hello, everybody. It is 1 o'clock on the dot. We do still have some folks joining us, but we will work on getting everybody admitted and get you started so we can keep to our timelines today. My name is Melissa Mosley. I'm the Quality Improvement Manager for Great Start to Quality. I'd like to just take a moment to welcome you all to the Great Start to Quality Connection this April. McKenna, if you can go ahead and transfer us to the next slide, that'd be great. We are going to cover just a quick little bit here on tech etiquette. So if you can, please keep yourself muted when you are not talking. If you want to go ahead and turn your camera on, we would welcome that. It's nice to see some friendly faces in our group today. Please feel free to use the chat feature. And then we will have some Q&A time later today to address all of your questions. All right, so our agenda for today is a standing agenda. It's the same one we use every month. We'll do a quick welcome, do some introductions, have a presentation on the quality indicator guidance document and give you some updates. And then again, we will have some dedicated time for Q&A with myself and a couple of the members of the validation team. All right. So again, like I said, my name is Melissa Mosley. I'm the Quality Improvement Manager for Great Start to Quality. And with me today, I have Nicole, and I'll go ahead and let Nicole introduce herself.
It's nice to see some familiar faces and some new ones. I'm Nicole Kretschmer, and I am one of the validators on the Great Start to Quality team.
So for today, we do have a few learning outcomes. We hope by the end of this session, you're going to gain some additional or new awareness about Great Start to Quality, its purpose, and how it supports children, families, and child care providers across the state. We hope you'll be able to understand the resources available to child care programs and have a clearer picture of the quality improvement process. And then really, we hope you understand who are the people that can support yourself and your program and how to reach out and who to reach out to when you have a question. So here is a model of Great Start to Quality in our process. So we go over this every time because you may have not joined a quality connection before, or maybe you're a newly licensed program. So at the foundation of Great Start to Quality is the first quality level, which is maintaining health and safety. At maintaining health and safety is all programs who are licensed and not yet moving along or moving through the process for Great Start to Quality. After maintaining health and safety, you'll move into reflecting on quality. That's when you go in, complete an application, and start reflecting on the quality indicators in the self-reflection. Enhancing quality is where you have spent some time setting some goals and receiving coaching from your quality improvement staff at the 10 resource centers and preparing for validation. And then enhancing quality validated is the actual process where your program submits that self-reflection for review or validation. And one of our validators goes through, reviews your evidence, and maybe has a phone call with you to discuss the evidence that you have uploaded for the indicators. And then demonstrating quality is where your program will have completed the on-site observation and has met the threshold scores for those tools. Today, we're going to spend the majority of our time talking about the quality indicator guidance document and the revisions that we've made. We're going to go a little bit more in depth than what we have in past quality connections, where we've just kind of highlighted some indicators and shown you the revised guidance. We're actually going to go through the majority of the guidance document together today. During this session, if you have any questions, please feel free to just come out or come off mute and ask away. Interrupting us is perfectly okay. Sometimes it's hard to manage the different pieces on our screens. So I'm going to turn it over to Nicole, and she's going to do a little bit of sharing with you of the revised quality indicator guidance document.
Thanks, Melissa. So I'm excited to share with everyone today about the changes that we made to the guidance document. This has been project that's very deep to all the validators' hearts. We've been working really hard on this. We've had a guidance document for many years and many different versions, and we keep getting feedback from providers, and we're super excited and grateful for the feedback. It's been very helpful, and we've applied that with these changes that we're going to share today, and we're hoping that you all find it helpful as well, and that it is actually going to make it easier as you're filling out that self-reflection and moving into the validation process. So one of the first changes that we made in the guidance document is we added some tips and tricks pages. So at the beginning of the the beginning of the guidance document, the first thing you're going to see is just an overall self-reflection tips and tricks. And it's really just an overview of some important things to keep in mind as you begin filling out that self-reflection and looking at those indicators and thinking about the evidence. So as you can see on the screen, we know it's a lot of words. It's a screenshot directly from the document, so we don't expect you to read everything, just to kind of give you a sense of what it's going to look like. So you can see in there, there's information about what types of things you should put or type into that document comment box, what it means when an indicator has bullets. If there's different types of indicators, some that ask for a description, some that use the word shows. So we've provided some overview on this page that we hope is helpful as kind of an initial introduction, so folks are prepared as they dig into the meat of the indicators. And then there's also some clarification you can see on the right side about the professional development and qualification indicators. Those are a little different than others because they all come directly from data from my registry. And then also evidence, some things to keep in mind. So we're hoping that this page is just a good reference when you are starting, or as you get into it, you're like, what was I supposed to do? You can always click back to this. So that's our first change. The next one is another type of tips and tricks that we've added throughout the document. So this is called the category tips and tricks. And so each of the 5 categories of the self-reflection will now have its own individual tips and tricks page. So this page is really meant to be an introduction to that new category. So the one that we provided as example on the screen is family and community partnerships. So that's that first category in the self-reflection. So on this page, you're going to see which of the indicators in that section apply to different age groups. So you can see on this one that the first indicator, FCP1, applies to infant, toddler, and preschool. And then the rest of the indicators in that section apply to those ages and school age. So it just kind of gives a high-level overview of the indicators. It also talks about which program type the indicators are applied to. Some indicators are only for centers, some are for family child care programs, so we clarify that information. And then you can also see on these pages, it'll include which indicators are shows indicators versus description. And then the last thing that's important to know, each of these sections, if you look to the bottom right of that picture there, you can see that there's a link. It says to the frequently asked questions. So each of these tips and tricks page will have some links at the end that are important to reference for that section. So Melissa's going to dive in deeper to the frequently asked questions and some of the other features of the document, but links to those features are here on the tips and tricks page. So it's easy for you to click on it if you're using an online version and kind of go back and forth and get all of the information that you need. All right, so now I'm going to kind of shift. That's kind of the intro, the help support information. The next thing that we really wanted to share about the document is the specific indicators themselves and how they're kind of set up. So we have 3 different examples from the guidance document. These kind of cover a good majority of the indicators. Just know each indicator is its own thing. It's looking for individual and specific evidence. So we encourage you to look at each one separately, but we're hoping this kind of gives you a good sense of what the new version of the document looks like. So similar to the old documents, you see the indicator in the top left, and right below it is why it's important. So we think that that's one of the most important things to highlight. Why is this indicator here? What does it mean to me? Why is it important? And then right below that is the indicator selection options, which we had in the previous version of the document. So those are the choices that you get to make when you're actually filling out the self-reflection. Is it something you're currently meeting? Are you not meeting it? Is it something you want to work on a goal? Is it something that's just not aligned to your program? And then the next piece below that is the reflective questions. So this really gets into how am I implementing this in the program? So we really put these questions in there truly for you to reflect with your program policies, with your staff, the things that you're doing to see, am I meeting this indicator? So they're just open-ended questions you can ask yourself to see, am I doing this? Or what types of evidence might I have that would meet this based on answering these questions? And then we shift to the right side. This is where the biggest change has come in, and it's about evidence. So as a validator, I get to talk to programs every day, which is the joy of my job. But most of what I do as I'm talking to programs is clarify what exactly is needed for the evidence. It's very confusing. So we're hoping that this new clarification in the guidance document is going to help you. So the first section that you see on the right side there is examples of evidence to meet the intent of the indicator. So this indicator is a shows indicator. It asks that the program shows what they're doing. So for shows indicators, you're going to see that there's some clarification. So there's that little purple word and in the middle, which means we need two different types of evidence. So we've really spelled out clearly the choices of evidence you can get. So the first piece is to upload something that is a policy or a procedure or a statement, something that explains what you're doing. So those are the examples in that first section. And then the second piece of evidence after the and is asking what additional supporting documents you can upload. And then it provides examples again. So all of the shows indicators, you're going to see that general format of upload something that explains what you're doing and upload something that really shows what you're doing, a supporting document for implementation. So we're hoping that really makes it a lot more clear about what exactly needs to be uploaded. And then the final section under that is, does the evidence show? So this is a new section that we added. You'll notice instead of bullets, this section has check boxes. And the intention of that is that you can really review this as you're completing that indicator in the self-reflection and check, have I met all of these things? So the intention would be that you can check all of those boxes. And if you've done that, then you can select currently meeting for your program. If you can't check all of those boxes, then there's something that you might need to add or work on, and then you might, before you can say currently meeting. So I hope that made sense. I'm going to pause just for a second, because that was a lot of information, and I know I talk fast. Were there any questions coming in the chat or anything anybody was wondering? Feel free to unmute if that's helpful.
I have a comment, Nicole.
Yeah, of course.
I've been through this process twice already.
Yeah.
And I really like the fact on the right-hand side where you have examples of evidence and that really helps me.
We are glad to hear that feedback. We were hoping that would be helpful for you. I will say, as a validator, it's helpful for me. Sometimes I'm like, is the evidence that they upload, does it meet what I need? So this is super helpful for everybody. So thanks for that feedback. We appreciate that. Any other questions?
Sorry, Nicole, I'm going to pop in for a second. Deborah, this is one of the biggest things that we heard. So we did share our draft last fall. We've been working on this for a very long time. I did share it with a handful of providers that I knew would be very, very honest with me and tell me, were we going in the right direction and what was still missing? And that was the biggest piece of feedback that we got from every provider that this was shared with, is that is what I was missing. I didn't understand when it said upload to, that it couldn't be two types of the same, or two pieces of the same type of evidence. So I'm excited to hear that you agree as well, because we want to get this right, which is why it has taken us so long to get a revised edition out to everyone.
Thanks, Melissa. Super helpful. All right, so now that we've done that one, we'll do another type of indicator that we have. So the next one is a description indicator. So those of you that have done a validation call, you probably hear the validator say, I'm going to sound like a broken record as we're talking about these description indicators, because they're looking for very specific things and they're different than a shows indicator. So you'll still see the general format for these indicators is the same as the other. You see the indicator in the top left, why it's important below it, the indicator selections below that, and then also the helpful reflective questions. So if you're really new to the process, that reflective questions is going to be kind of the helpful place to start, we're hoping. And then still on the right side for this description indicator, you still see the examples of evidence, but these ones are going to look a lot different. So there's no and for this one because all we need uploaded is one thing. We just need a description. That's all it's asking for. So you'll notice that each of the bullets all ask for a description. They all start with a description for, because that's what's required of the indicator. But the content of your description may vary based on the needs of your program and the families and children. So we provided some examples of things you could include in your descriptions that may be helpful. And then you'll notice the does the evidence show? There's two checkboxes, which you may think, well, if it's only one description, why are there two checkboxes? Because in addition to uploading the description, you also have to add a statement in the comment box or upload a document that explains how it's shared. So you'll notice in the description indicators, they all say program provides. So either program provides families or program provides families and staff. And we have to see evidence of that. So that's the most common thing in the validations that programs forget. It's a very little nuanced thing. So we're hoping by adding that little checkbox in the guidance document, it'll be more helpful for folks as that reminder to make sure you're adding how is that information shared with both families and staff. All right, and then we have one more indicator type or example that we wanted to share today from the guidance document. And this is for the PD indicators. So when I say PD, I mean professional development. And these indicators are different because all of the information pulls in directly from my registry. So we know you all work diligently to get your staff to take their training in my registry, upload their qualifications, do all of those things. And then all of that information and data and hard work you put in generates into a report that you can review and that the validator reviews to align to these indicators. So we've made these indicators look a little different in the guidance document. So you'll notice on the left, we still have the indicator, we still have why it's important, and we still have the indicator selections. So that's all going to feel the same. What's a little different is that on the right side, you'll see there's the reflective questions at the top. Again, very similar. But what you'll also notice is that there's no evidence section. That's because you can't upload evidence for these indicators. It all comes from the report. So in the professional development section, we've made this all check boxes, and they're all things that you can check or verify in that professional development report to make sure it's accurate. So if you can check all these things in this section, then that's when you can say currently meeting to that indicator. It means, hey, I've checked and verified that I've done all these things. You'll also notice in this indicator and some of the previous ones, there's those words that are in blue, italicized, and underlined. So those are links. So if you're using this document on your computer, if you haven't printed it off, you can click on those links and it'll take you directly to more clarifying information in the document to help you. So if you're like, what does it mean to have the correct position title? You can click on that link. It'll take you to the section that will define what that is and exactly what you should be looking at in the report. So we're hoping those features are helpful for folks. So that was the last indicator type. I'll pause one more time before I turn it back over to Melissa. Were there any other questions about the indicators and the layout or comments that folks had?
Nicole, we did just get one question in the chat. If you could define the 12-month period.
Yes, absolutely. So it will be defined in the guidance document. So if you catch it here today, great. But if you don't worry. So the 12-month for Great Start to Quality is 12 months from the time prior to the time that you submit the self-reflection. So when you're submitting and you're moving forward with the process, you're saying, hey, I'm ready for a validation. We go from that date to 12 months prior. So it's a little bit different than licensing that looks at calendar year. So it's from the time that you're ready to move forward into validation, you're submitting to 12 months prior. What we've done to make sure that folks know that they have that information, it's accurate, is the report that's in your self-reflection. Right before you're ready to submit, you want to review that because that will be current. And then once you push that submit button, that report locks. And that locked version of the report is what the validator reviews. So you don't have to worry about it changing. Like, oh, on the date that I submitted, it was right. I checked, everybody had everything. Don't worry, it won't change. The validator will be looking at that locked report. We also prorate for new staff. So keep in mind, If you have staff that have been there less than a year, we prorate the required number of professional development hours for that indicator PD9, just to make sure we don't expect a staff that's been there 6 months to have the full 24 hours. So we have a nice proration chart that we've added to the document that clarifies that. And the same for staff that have been there less than 90 days. You want to make sure that they're linked to your program, that they're added as an employee, that they're working on those steps in my registry. But if they don't have those PD hours, we understand it takes time to get that, to train folks. And so those aren't required. That was a good question. I hope that clarified.
Yeah, that's a really good question. I'm going to add one more little piece to it, Nicole. So when you're coming through the process, you submit the self-reflection 2 times. So when you submit initially, that does not lock the professional development. It is when you submit after you've applied for validation and on-site observation. So it's that very last submission.
Thank you, Melissa.
Yeah.
So another question.
Yes, go ahead.
So if my currently November 2026 is my date, if I submit in September, that locks in my date?
That locks in the 12 months that we're going to review for professional
So you're going to
development.
review from September 2025 to September 2026.
Correct. Yeah.
Gotcha.
Good clarifying question, Deborah. All right. Don't see any more questions, but please feel free to interrupt us. So as Nicole mentioned, there are a lot of words or phrases that are that lovely blue and underlined color throughout the body of the indicators. Sometimes that's going to take you to the glossary. So where Nicole was showing on the prior slide, position title was underlined. That would take you to the definition of position title and how we are looking at that around those position titles in the registry. Sometimes it might be a phrase that would then take you to the frequently asked questions. So we have tried to define as many of the terms as we can. I will say that might change in the future. And we might have new ones that we need to define. So this is always going to be kind of a work in progress. We're always going to be asking for feedback on it so we can continue to make updates in the future. Hopefully only once a year, and hopefully we could get it done much faster than what we were able to do this time. All right, hold it. McKenna, I'm going to pause for 1 second because I see Marcy. Looks like Marcy has a question. Marcy, if you want to come off mute and ask your question, please feel free to do so.
I can do that. I was afraid my dog was going to bark. So
I have a cat that's running around my legs right now,
okay,
so
okay.
I understand.
Sure. So we have staff that sometimes will mark in my registry that they work with, like say toddlers and preschool children, or preschool children and school age. When they're doing their PD, would they have to do 2 hours in then each of those age groups because they marked that they worked with those kids, or just 2 hours in like their primary age group?
That is a really great clarifying question, Marcy. We're just going to look to see that they have 2 hours in one of those age groups, or maybe they have 1 hour in infants and toddlers and 1 hour in preschool. That would add up to the 2 hours. We know across the state that many staff work with many different age groups. So as long as it adds up to 2 and is aligned or one of the age groups that they have listed, they would be fine.
Wonderful. Thank you.
Yeah, you're welcome. All right. And I do see Anita asked in the chat, just a clarifying question, that professional development does not lock when you submit the first self-reflection. It only locks after you submit it the second time. I know Nicole answered it, but I want to make sure everybody else hears that answer. That is correct. The first time you submit it, validation does not look at that first submission. We only look at the second submission. It's a great clarifying question again. Yeah, Anita, we're going to get there. You're not going to see this new guidance document yet, but that I will give you some more reasoning and rationale as to why in just a minute. Okay, so after we have the glossary, you're going to see the frequently asked questions section of the guidance document. This used to be a separate document, and the feedback that we got was that's not helpful. We need to have this all in one document. So it is all combined now. In here, we have sections about general questions about validation, general questions just about validation. I think there might be a couple others that I am now just blanking on. Nicole can correct me if I'm wrong.
Yes.
And then we have frequently
Sorry, Melissa,
asked,
I was
yeah.
pulling up the guidance document, or pulling it up. It's mostly about validation, like timeframes, when to upload documents. Do I need things for all staff? What do I put in the comment box? It's validation type clarification.
Perfect. Thank you. And then we will have sections of frequently asked questions for every section or category in the self-reflection. So family and community partnerships, inclusive practices, curriculum, instruction and learning environment, professional development, and then the staff qualifications category that also includes a little bit of administration and management. Along with adding in the frequently asked questions document, we have added in some appendices. So previously, these items all lived on the website. They still do, but anytime a link would change in the website, they wouldn't work from our guidance document anymore. So we've also just embedded them all into the guidance document. So you'll be able to find a tracking sheet for your My Registry employment, the approved screening assessment and curriculum tool list, and then the environment rating scales and the social emotional PQA self-assessments that are used for an indicator. And then you'll find those professional development indicator requirements by position and the proration chart. So everything is going to be found in one document now. So we hope that that is helpful for you all. So Anita, I'm going to answer your question now. Where is the new guidance document? The new guidance document is not live yet. It is being translated into Spanish, Swahili, and Arabic. It's also being updated in the system. We can't publish it until everything in the system is going to match, because otherwise it's almost like we've got two different things rolling around out there. And how are you going to understand what we're looking at and what we need? It seemed like it was going to add a lot more confusion to publish it on the website, but not have it updated in the system, because that system includes all that help text and examples of evidence in it. So we're trying to alleviate confusion. We are hopeful that it is going to be live quickly, but systems work and getting things updated in there does take a little bit of time. They are currently working on it. So I'm hopeful that maybe at the next quality connection, I can share that it is live, but do know when we publish it, it will go out in a loop and it will go out on social media as well. And your resource centers will be sharing that information with you too. So good question. I know you want it. I don't blame you. I'd love to be able to give it to you right now. I just don't want to add a whole other layer of confusion out into the already challenging world that we are in. Okay, so I'm just going to put this here. The next quality connection is going to be June 11th. This quality connection is in the evening. So feel free to go ahead and get registered for that when it comes out. It should be coming out in the next edition of the Loop. Go ahead and get registered, and hopefully I'll be able to give you a really good update then. And then I think now we're just going to kind of turn it over to you all answer any questions that you have. If there's something specific you'd like to see in the guidance document, we can do that as well. You want to keep up to date with us, we do have a Great Start to Quality website. That's www.greatstarttoquality.org. And then please feel free to follow us on Facebook and YouTube. What questions might you have? They also don't have to be just about validation. I might not be able to give you a super solid answer if it's about something I'm not super clear on, but I'm happy to try.
I have a quick
Um,
question.
Yeah, Gloria.
How are you? How you guys ladies doing today? First and foremost.
We're doing all right. It's been a little bit of a week. How are you?
I know it's going. So I'm already on the Great Start to Quality, whatever it is. But my consultant that I used to have, she left. So I don't know who am I supposed to reach back out to, or what I do now, or where I go now next. What I do.
Yeah. Who were
Like
you
I'm
working with previously?
Kelly.
Kelly.
Oh my goodness.
What region are you in, or what county?
Oakland County.
Oakland. Okay. I am not sure the answer to that.
Okay.
I can get you an answer. Do you have a, well, I don't really want to ask you what your phone number is, because this is
I
being
did put my email
recorded.
in the chat.
Perfect. I will shoot you an email, Gloria.
Okay, yeah, because I've been struggling. I'm like, who do I go to next? Like, now that everything changed, I was 3-star. Now I'm to level 1. So I'm
Okay.
like
You
trying
need
to
some
figure
help.
it out. Yeah, I need some help. Who do I turn to, or where do I go from here?
Yeah, I will, when we get off of this call, I will reach out. I'll see who your new consultant is, and I will
Please.
send you an email and let you know.
Okay, thank you. Appreciate
No
it.
problem. Yeah.
Just in general, too, if you're not sure or you have a question like that, you can always email us. So Great Start to Quality at ECIC, the number 4 kids.org. And that email address is all over our website, or you can give us a call too. So if you call our 877 number, it's 877-614-7328. And we can put this in the chat as well. That number will actually connect you directly to your resource center. So if you ever
Okay.
can't get a hold of somebody and you're like, where do I call? That number is right on our website
Yeah,
too.
well, first I started with Stephanie Pere. I started with her first. Then they moved me over to Kelly. And then I've been with Kelly since I started in 17. So I'm like, she left me. Now where do I go from here? So I appreciate that. I definitely get on the website and get the number and email also. And then I'll look for yours also, Melissa.
Yeah.
Yep. I'll just shoot you an email after this. I typically get a pretty good response. I do know that Wayne Oklahoma Resource Center is in the process of filling a few positions. So they will have somebody temporarily that will be able to reach out to you until they have someone hired and to replace Kelly's position. So.
Our amazing resource center staff are so busy. We appreciate them so much. I am very fortunate. All I have to know is validation, and those resource center staff have to know everything. So the next time you see your coach or your specialist, please thank them on my behalf, because they do such a wonderful job.
Yes. So Anita, you received your enhancing quality validated quality level. It's valid through, oh, of course, something is popping up here. Valid through March 25th of 2027. But you're waiting for your on-site observation now. Wondering when your DHS payments should increase based on our rating. Were you previously, what was your rating prior, Anita? Because if it was equal to or above enhancing quality validated, you're going to maintain that. Okay, so it was not. I believe that should have already gone through. So I am not super familiar with the DHS payment process or timelines. I know we have a couple QI staff on here. I don't know if any of our QI staff know the answer to that question. If not, we can look it up and get back to you, Anita.
I can reply
sorry.
to that. So Anita, yes, your reimbursement should increase on that next payroll that you, or excuse me, that next pay date that you go to for your billing for your CDC. It should already be increased.
Thanks, Rosanna. And if it hasn't, Anita, go ahead and send us an email and we will see who we can reach out to. So, great questions today. What other questions are people wondering about?
Hi there, my name is Abria, and I have a question. I'm just wondering how much the My Registry site talks to Great Start to Quality and vice versa. So something real simple, we had a phone number change at our site. And so if we change that in one of those areas, will it change in the other area? How much do those two platforms talk?
Great questions. So we actually use the same platform. We just have different modules. So when you go into your organization profile and update that phone number, we see the updated phone number. We kind of have one part of the org profile and the registry houses us.
Thank you.
However, that
welcome.
is different than your public profile on greatstarttoquality.org. So if you are trying to change that phone number publicly for parents or others to be able to contact you, you will want to go into that public profile and update it there. And there are, depending on certain information in that public profile comes directly from licensing. So if there's something that is not green and you can't edit, you will need to reach out to your licensing consultant and have them update it. And then they send that data directly to Great Start to Quality. So if it doesn't let you edit it, you want to head to licensing, and you can always reach out to us and we can clarify that for you too.
Okay, thank you.
Any other questions? Want to give time and space to answer any questions that you have, but I also know that your time is really valuable and you've got a lot that you probably are trying to get done as well. So if we need to give time back, we're happy to do that.
While folks are thinking of their questions, Melissa, I'll just verify. Did we highlight the next quality connection and did that get put in the chat, the link for it? Do we know?
We did highlight it. I don't know that if I have, I can try and find the registration.
I will try to look for it as well, just because I know sometimes for folks it's easy to do it right in the moment. So I will see if I can find it as well. If not, it will come out in the loop.
Yeah, it's June 11th, 6 p.m. There we go. I just found it, Nicole.
Oh, beat me to it. Thank you.
So here we go in the chat. You should be able to. Oh, Christina found it too. Oh, and I just direct messaged it. So mine didn't go through anyways. Anita got it.
Christina's our on the ball helper person. Thank you, Christina. It's very hard to manage all the questions and the chat and all the things. It takes a team effort.
All right. It seems like we've kind of come to a low. I'll hang out for a couple minutes just in case someone has another question. But I appreciate you all. Thank you for joining us today. Hopefully you are excited for the new quality indicator guidance document. And hopefully at the next quality connection, we will be able to tell you that it is live and provide you with that document. I hope you all have a wonderful day.
Thanks, everyone.